spread with the self-reports because we're not getting as heavy of testing as what we would have liked at first. With the self-reporting, it's helping us to monitor the epidemiological spread within our county of the possible cases. We have also experienced within our county, as of today, 3 fatalities due to COVID-19. This morning at 11 o'clock, KU Med Center reported that within their hospital, they had 27 tests that were pending. They had 16 confirmed cases of COVID in the hospital, 4 of which of those were in ICU, and 2 of those were on ventilators. So these are the things that Mayor Alvey talked about as far as not wanting to put the pressure on the healthcare system. Those are some of the cases that we are relating. So we are continuing to do contact investigations with all of our known positives, as well as finding out who they've been in contact with, where those contacts have been, and trying to do the self-quarantining individuals who have a possibility of having the COVID. With that, I will turn it over to Dr. Alan Greiner, who has put in place the stay-at-home orders for Wyandotte County.
Thank you, Terry. Trying to maintain our 6 feet of distance around here. Hi, again, Alan Greiner, Health Officer. As everyone's aware, we put in place the stay-at-home orders on Tuesday. I think overall, all of us at the Health Department, as well as across the UG, have been pleased with the overall response to this. We fielded many questions at many levels. The mayor's been getting them. I'm sure many of the rest of us in this room have been getting them. They're coming in on the Health Department website, and I'm sure the main UG website as well. The police department has now put up a full-time call-in line to answer questions from businesses and others who are trying to determine what are essential activities and what are essential businesses. We've had a lot of people asking about, do they need to be carrying some kind of a letter or authorization that they're engaged in an essential business or activity? And we've been trying to tell people they won't be stopped and that won't be necessary, but we've got to keep getting that word out. And I think there are certain pockets of the community that need more reassurance that this is really something that we're wanting people to evaluate for themselves and evaluate for their own businesses and make smart decisions and decisions that will protect themselves, their families, their customers and clients, as well as the community at large. And again, I think we've all been pleased at how positively people have responded to our feedback and guidance around that. We've had a few small issues, but again, I think PD's done a great job trying to educate folks and then do a little bit of community follow-up. We did have a few issues and questions we needed to answer for some funeral homes, so we went out today and visited a couple funeral homes and are going to issue some additional guidance, I think, to help that sector. But I think overall things are going well. And again, hopefully that is going to make a major impact on this. The primary thing we're trying to avoid with all this is what we're hearing is happening in New York, where the healthcare system just gets completely overwhelmed. You can tell by the numbers, even the small numbers we have, that there are lots of serious cases that come out of a fairly small number of total cases, and we know our community is vulnerable, and so we've been working closely with both hospitals, as Terry mentioned, really connecting on a daily basis with their infection control programs, and then also with some of the leadership at both health systems. They're key to our stakeholder meetings that we're having every morning at 11, and I think the pre-planning that's going on in both both our hospitals, Providence and KU Health System, has been, I think, really strong. There continues to be fears. There's nervousness about whether there's adequate amounts of personal protective equipment. There's fear that, again, that we'll continue to see more and more severe cases. But if we can keep the numbers down as we hope to with the stay-at-home order, then there should be capacity to take care of the sick folks that need it. There has been good movement in the last 4 or 5 days to increase testing capacity across the metro area and specifically in our county and our 2 health systems. We are also working at the health department to try to assist that effort and get more drive-through community testing sites up and running as soon as we possibly can. KU Health Systems started conducting internal tests in their own laboratory facilities 2 days ago, I believe it was, and that's helped them reduce their backlog of waiting on tests. They were sending a lot of tests to a local lab, Viracor, over in Lee's Summit, and results were taking about 4 days to come back. And that was a big problem for them because they were having to use a lot of personal protective equipment while they waited those 4 days, taking care of those patients under investigation. They are now able to get turnaround in about 10 to 12 hours with their internal testing, and that the numbers of total tests they're going to be able to do is going to ramp up over the coming days as well. We're not sure if that will spill over into providing us community testing opportunities, so we're moving ahead with a couple community partners that are willing to do drive-through testing, and we're also planning to try to launch a site here in downtown if we can as well, and we'll work with any labs we can. We're pursuing some grant funding as well with local foundations on that, and we think they'll be receptive to some emergency requests for funding so that we can get that off the ground as soon as possible. Other than that, that's really all I have. I will turn it over. Oh yeah, before I turn it over to Julianne, as you know, I've been the health officer for quite a while. In fact, I think it's 16 years now that I've been the health officer. I'm a family physician, but also have a little bit of public health training. But I'm just one guy, and so I have enlisted a colleague, Dr. Aaron Corveau, who has pretty much spent every single day for the past 10 days at the health department with me and our colleagues there working on this pandemic. And I wanted to introduce her, and we'll have a request coming up shortly. She is originally from New Mexico. She's trained as a family physician as well, but she's also board certified in preventive medicine and did all her public health training at Johns Hopkins. So she actually knows a lot more about public health than I do. And she's also probably way healthier than I am. And so we have a tag team act going here in terms of the medical and public health officer side of things that we hope we can continue, not just through this, but probably into the future as well. And I believe that University of Kansas Medical Center is going to support that without us having to make any fiscal or contractual changes, because we know it's the right thing to do. And I think that'll add to both the collaborative things we're doing as well as helping solve some of these community health issues. So that's Dr. Corveau, and we'll have a little more about her shortly. On to Julianne.
Thank you, Dr. Greiner. This is Julianne Van Loo, and I'm going to walk you through some of the things that we've got up on our website in the last few days. We really want to make sure, as our Board of Health and commissioners, that you know where to direct residents when they're looking for information, and that you know what activities we're working on. So if you're on the UG homepage, there's a button here. This is scrolling currently, but there's a COVID-19 button, and if you select that, it brings you to a specific page for the coronavirus on the UG website. I'm going to walk you through a couple of things we've added here. So the first two, Terry mentioned these on the outset, are where we're asking people to self-report their symptoms. That's already up in English and Spanish, And as she mentioned, the purpose of that is two-pronged. The first is to make sure that somebody, either a medical doctor or an epidemiologist, follows up with those folks to ensure they have proper guidance on what quarantine and self-isolation measures to take, et cetera. And then the second is to start to track the epidemiological spread of this disease. So we're currently taking in those requests daily. Our turnaround is about within 24 hours, and we're finding that residents who fill this out are really appreciating actually getting a call from a warm body who has medical knowledge and can provide them some guidance. So that's going well. We're working with other municipalities in the KC metro area to get them up and using the same tool. KC Mo, we hope, will be on that tool within the next couple of days, because right now we're getting a lot of other folks outside of Wyandotte County filling this out. But we want to make sure that those can be filtered to the appropriate health departments. We're really hoping that our media and communications around this can ramp up in coming days to make sure that our residents know that this is available to them. The third button here that says food needs request, we know that in these times of pandemic, within a few days of issuing something like a shelter in place, immediate needs start to arise. And one of those we know is around food for many reasons, because kids are out of school, et cetera, but also because folks are self-isolated and quarantined and can't leave their home to go get food. And then we also know that folks will start to have reduced hours and lose their jobs and also have a hard time purchasing food on their own. So this food needs request is one of our responses to that. We are partnering closely with Crosslines, and folks, anybody in the community, we're really trying to prioritize those who are self-isolated and quarantined, but anybody who's in need can complete this food request that funnels to us as a health department, and then we are funneling those to Crosslines, and we have solicited volunteers who are now delivering packaged goods or packages of food to the front doorsteps of those who are in need. So this has just been up and running literally for a day now. Tomorrow they'll start doing that dispensing of that food. And we're doing that largely through volunteers. So the last button here is volunteer or donate. So we want to make sure there are a lot of folks who have particular skills or who have resources and want to participate, and we want to make sure that we're kind of doing that in an organized manner. So anybody that you're aware of who wants to volunteer or donate can go to this button. We have already enlisted several medical volunteers out of KU, as well as out of Heart to Heart International, who are, like I mentioned, going to help with that food delivery. There's putting together toiletries, supply kits, et cetera. And as we become aware of additional volunteer opportunities, we're adding to those. So our goal is to just kind of be a hub and a pass-through where we're helping to get volunteers and needs coming through us, and we can pass them on to the appropriate resources in the community. The other thing I want to show you this evening is the dashboard that we launched just a couple of hours ago. So my colleagues over in the Knowledge Department have been working very hard with us on this. This will be updated every evening. It was just updated, I think, 10 minutes ago with the newest data from today. As Terry mentioned, we have 37 confirmed cases in our county, 19 that have been hospitalized, and 3 deaths. These numbers down here around self-reporting are from that tool that we showed about self-reporting. The word, I want everybody to understand what this means. So we've had 84 responses to that self-reporting tool and 37 what we're calling probable cases. We want to make sure these two numbers, 37, just happen to be the same currently. Those are not the same indicator. So there's confirmed cases that come out of positive lab results, and then these probable cases are folks that we have received self-reported data on, followed up, had a phone call, and determined, given their fever and respiratory symptoms, we believe that they are probably a case of COVID. So that's what that probable indication means. There are other kind of ways of displaying data that you can see here, tracking it over time. One drawback with data like this is that we cannot display it at the zip code level with a number lower than 5. This is a rule that comes out of Kansas Department of Health and Environment. So until there are a few cases in these other zip codes, but until they reach that threshold of 5, we can't display it on the map. So you can see here our zip codes that are over 5 are indicated in red, and you can see those numbers here down in this graph. Again, once we hit 5 for those other zip codes, those will start to fill in as well. So as I mentioned, this will be updated daily. We hope it's a way for folks to kind of keep their finger on the pulse and for people to keep track of this themselves and kind of know at a moment's notice what our given situation is. So I'm going to pass to Dr. Corvo, who's going to talk a little bit more about some of the social needs work that we've taken on at the health department.
Hello, hello. This is Erin Corvo, and I have to say that Dr. Greiner is a, a great influence and has been, it's just fun to watch him because he's so good at what he does, and so I have a lot to learn from him, but I appreciate that kind introduction. I just want to update you on a couple more things that are going on. Certainly, taking care of our citizens' social needs is high on our priority list during this time. As Julianne mentioned on the website, there was the button there for the foods needs request. You know, as we work with Crosslines, you know, they've just been wonderful. We've heard from the 211 line, the United Way folks, that calls are up about 300% in our community. And I believe Crosslines is also having just on average about 35 families that they're serving, and now are being asked for to serve about 160 families. And so that increase is real, and we're seeing that now. So I think there's a real concern for the supply of food, and so asking for donations, but also writing grants to get some money for food for people in our community. Also want to update you about our special concern about our homeless population. We are working with multiple homelessness agencies around the community, including the Greater Kansas City Coalition to End Homelessness, which works on both sides of the line in Missouri and Kansas, to secure a facility, a quarantine facility, where homeless individuals who may be positive for coronavirus or may exhibit symptoms of that can stay there safely and can be away from others and not pass the virus as well. And so this facility would have approximately 50 beds. We're just looking to secure mobile shower facilities there as well. And I believe there is a formal proposal that has been written up and is, I believe, in the hands of the city now to review. We're just seeing a big uptick, I think, in the hourly calls from our shelters in town. And so I think that from last week, you know, it may be kind of a rare thing to get a call, but now every hour we're fielding calls from folks who are concerned about coronavirus in the homeless population. So with that, I'll turn it over to Janelle Friesen.
Is this on? Hi, my name is Janelle Friesen. I'm the Public Information Officer for the Health Department, and I'm going to go through a little bit of what we've been doing with our communications, which has been a lot of different things. We're trying to just get the word out in a bunch of different ways because, you know, we know that's what we need to do to reach as much of our community as we can. So, for instance, we know from things like our citizen survey that one of the ways that people really like to get their information about, or two of the top ways people like to get their information about the local government is through just traditional news outlets and through the citizen newsletter. So we've done a lot of different things with our local news. You can go on the website, there's the latest releases, which has a whole bunch of press releases. There's just been just a few recently. So we've put out a lot of information to the media. I know that the mayor has done a lot of interviews with the media. Dr. Greiner's been a great spokesperson as well. And we also are going to be fast tracking getting the Citizen out pretty soon and have a lot of features about COVID-19 in there, talking about what the response is looking like in our community, changes to operations in the UG, other ways that resources are being provided and what everybody can do about this. We're also considering future mail type of communications like a postcard or something along those lines. And as many of you have probably seen, we've been doing things through our e-news as well. But we have been updating the website with some additional communications that we've been asked for as well. I know we've talked a lot today about great partnerships that have been going on, and one of those is posting employment opportunities through Workforce Partnership on here, because there are a lot of people we know have lost their work or have fewer hours right now. So we wanted to connect people to that resource, and there's some other economic resources on here. And then another section that we've done a lot of updates on is there's a frequently asked questions and more info section on here. So we have some general frequently asked questions on the stay-at-home order, because we know people have a lot of questions about that. And we also have a business-specific frequently asked questions, because many of the questions we've been getting, a lot of the calls we've been getting at the health department and all sorts of departments, the UG and 311, the police department, is from businesses trying to better understand how this affects their business. So we have both of those FAQs that we've been updating every day. We also have been getting asked a lot for print materials and that type of thing. So we now have links to flyers where you can, community groups can print these off to give to people in their neighborhoods. We also have a bunch of these that we got professionally printed with flyers and posters that some of our staff are going to hand out to different locations in the community. So for instance, some businesses that are still open could put posters up and have other resources there that are available. We also know that the police department had some materials geared toward businesses that some cards they printed out so they can hand out when they're having a conversation. If someone's asking questions, they're confused about it, to help them better understand what this means for their business. We've been doing a lot of videos. We have a tab where you can see that on this website. You can also see these videos on social media, on YouTube, and on UGTV. So we've had some great updates from the mayor, from Dr. Greiner, Dave Reno, the public information officer for the Unified Government, and myself did an update recently. We have some other videos coming up to do some further dispelling of myths around the stay-at-home order, for instance, understanding what that means for things like economic development or the police department. We have some videos I'm working on with other staff at the health department to get them in several different languages to explain the stay-at-home order as well. And we just have some other things where we're reaching out to partners to make sure that we have materials that are more accessible for folks who may not be able to use all the materials that are on here. And we just want to make sure that the best thing we all can do right now is to further emphasize that this is a serious situation, but there's something that we can do about it. If we all do our part with this, with the stay-at-home order and taking those basic steps for ongoing hygiene and just staying home as much as possible, that we can do something about it.
All right, thank you. And Mayor and Commission, as you can hear, we have an outstanding group of individuals that's here presenting tonight, along with a great department and our doctors from KU that are doing an excellent job in serving and taking care of our community through this time. I believe they are available for questions if you would have anything you would like to ask them at this time.
Mr. Bach, this is Commissioner Bynum.
Yes, Commissioner.
I have, obviously, we want to start by saying a sincere thank you to this team and everyone that's working in the Unified Government. I think what you're doing is remarkable, and we salute you and support you. Do we have a number of how many of our Wyandotte County residents have been tested? I have two questions. That's the first one.
It's hard to.
This is Dr. Greiner. We actually do not have an accurate number, because now most of the testing that's happening is going to private labs, and there are multiple private labs, at least 4 we know of, that the local healthcare providers and facilities are sending tests to. The only way we get any information back about that is when a test comes back positive. Those labs are required to report that positive test to the state, at the Kansas Department of Health and Environment, who then informs us of that positive. We actually don't get any information on the negatives that go through the private labs. We have gotten information from KU Med Center that about 80 and 90% of the tests they've done over the past 2 weeks have been negative. So you can take their number of positives, which right now, and some of their positives have already been discharged, but they have 16 positives in the hospital now. So if you think of that as a 10% or maybe 20% of the total numbers of tests, they've had quite a few negatives. The ones that have gone to the state labs, we do get both positives and negatives out of that, and I don't have that information right in front of me. I think we can get it from Elizabeth, our epidemiologist, or is it on the
They do
dashboard?
have it on their website.
Yeah, so we'll pull that up.
Is that it? I think this is it. Okay. They have a public update that they do every day. And they show for the state how many were done in private labs, how many were done at KDHE as far as positive cases, but then for each county, they show the positive cases. Somewhere they have the negative. Oh, right, total negatives for the state. 2,869.
And you just linked to this, Janelle, from our website, or did you go to the state website?
I went
for
to the
this
state
information?
website, but I should have remembered that you now can get to that under the more info section. We have the KDHE website linked from there.
So
which
she's
is not
referencing, if
working,
you
so we'll have
go to
fix
our
that.
website, you can click on the more info, and it'll link you directly to the state's website, and then it shows you that number of over 2,800 across the state
Okay.
test.
Okay, I appreciate that. My second question is a little bit more personal. I have a friend who has been waiting 7 days now for a COVID test result. Do you have an understanding of why a test result would take 7 days? It had to have been done through a private physician's office. It was suggested she get tested when a coworker on her job, which I don't even know whether that was in Wyandotte County, but a person who works the same place she does tested positive, and so they were encouraged to test, and it's now been 7 full days for a result, and obviously that's creating anxiety. I'm just wondering what would make a test take so long.
Yeah, I think we're hearing these kinds of stories. We're hearing anything from, again, the 10 to 12 hours that the internal KU tests are now taking to up to 15 days. Some places are utilizing labs that are in distant parts of the country where they're actually having to send the sample by FedEx or some other method, and then they're waiting. But a lot of these labs have tried to ramp up their testing and do that very, very quickly. And even when they've tried to do that, in some cases, I think they've been inundated with tests over the past few weeks. And again, in some cases, coming in from who knows where, and it's created all these bottlenecks where you've got maybe a lab that said they could do 200 a day, and now they're trying to do 800 a day, and they get way behind. And unfortunately, it's really, really bad, not only for the individual patient who's anxious, but also for the public health work that we want to do, trying to track things down and make sure we're contacting the contacts of different cases. And that's the exact reason why we pushed last week, and we're real successful working with the whole team here to get that self-reporting operation in place. It allows you to think a little bit about what the public health issues are and what you should be doing way earlier than you would if you have a test bottleneck that's making people wait 2, 4, 7, 15 days to get their results back.
Thank you.
Are there other questions from the
Mr.
commission?
Yes, Mr. Bach, this is Commissioner Philbrook. I would like to direct a comment. Thank you going out to, of course, everybody that's working so hard through City Hall. I don't know how you guys are doing it, but y'all are a blessing. That's number one. Number two, I want to thank Dr. Cornell. I'm not sure exactly how to pronounce your name, but I want to thank Dr. Greiner for bringing you on and this is what family's about, and I have a feeling you're an extended part of the family. I also want to thank KU Docs too for jumping on the bandwagon and being so helpful in everything they're doing. Now I'm going to switch over to David Reno as the Public Info Officer. And David, thank you so very much for bringing Workforce Partnership on so quickly, because we were capable of sending people to file for unemployment, but if we have plenty of jobs out there now, there's plenty of people that are needing jobs. So thank you for making that connection, and just thank you very much. That's it.
Thank you, Commissioner.
Mr. Administrator, this is Commissioner Gail Townsend. I have a question or two.
Okay.
Well, again, thank you and all of your staff everywhere in there in the room who makes it possible for us to participate by phone. But you all are on the front lines every day, and I appreciate all your efforts, as well as every member of the health department there in the room and not there in the room. Also, our KCK PD, our representative there in the room, and all of his fellow officers and staff. My questions really are for Dr. Greiner, and appreciate him and the expertise he's brought on so much. So since we have this opportunity to use UGTV, I would ask him if he would share a little bit more about the plan to visit our mortuary providers, and to also talk about the distinction between being able to have mortuary services provided and what's going on with the funerals and the exemption that was removed for gatherings of 10 or more that affect funerals, weddings, and church gatherings.
Sure, and it's really been a team effort to work on this, so I have not been alone in this, and I really appreciate everybody's help, especially on the legal side with these issues. They're really tough. All these decisions have been very hard to make. We know that mortuary services have to go forward. They're really considered essential. Whether we fully spelled that out and had that all properly described in the order, I don't know that we did, and we're aware that there's been some flex to things, but we knew we had to have mortuary services continue. And we then started working to describe to funeral homes that we wanted them to only have 10 or less individuals in the funeral home for a given viewing or a funeral service. And we actually, the PD was out and was approached by one of the funeral home proprietors who said that he might need police help if families wanted to gather in larger numbers, and that he was considering calling 911 if that happened. And so we wanted to get out in front of that, and so that's one of the funeral homes we visited today. That he hasn't had any problems. He said he actually had a funeral last weekend where he had to ask a large number of family members who had come to the parking lot to disperse, and that they couldn't come in, and they kept their numbers under 10 in the facility. But then he gave us a report that there were other facilities that were trying to do viewings or small funeral services and rotate 10 individuals in, and then they go out, and then another 10 individuals come back in. And we wanted to make it clear that we didn't think that was appropriate under the order, and that it was going to expose a lot of people to risk. Our preference would be that people aren't even gathering in numbers of 10 or less, especially if we've got any high-risk individuals over the age of 60 or with chronic illnesses or those kind of things in those groupings. But I think what we're trying to do now is just make it clear that all the facilities should do the exact same thing. And so we'll we'll be working with legal in the next 12 hours, 12 to 18 hours or so to get some kind of a guidance document completed and in the hands of all the businesses that provide those kind of services, so that we're clear on that and that it's a level playing field. I think there was some concern among some of these businesses that business was being shifted from one place to another because it wasn't a level playing field. So we're trying to get that sorted out. Does that answer that question okay?
Yes, thank you very much. Yeah, we don't want a situation created where people are forum shopping for funeral services and trying to skirt the orders. So I'm very happy to hear that a targeted attempt at that industry locally is being undertaken. So I appreciate that. The other thing that I've been telling people under the orders to consider, that when you say 10, that includes the staff of the funeral service provider as well. So 10 is 10. But thank you very much. Appreciate it.
Thank you, Commissioner. Are there other questions? Mayor, that would conclude our report on COVID-19 at this time, unless there's anything else you would like us to do.
No, I think we need to move to the, do we need to take action to appoint an assistant to Dr. Greiner?
I believe we're doing that after our, during our formal board meeting, and then you'll convene
Okay.
and then assign me authority to be able to make that appointment as part of the
I
agenda.
understand. Okay, thank you. I missed that. Thank you. So that is it. We are adjourned until 7, at which time we'll be planning and zoning and regular commission meeting. Thank you all.
Thank you.